Hi friends, welcome back to my channel Smart Living, and in today's video I will tell you that why is healthcare expensive in US, or why the health insurance is that much expensive in USA. So there are 6 reasons that healthcare is so expensive in the US. Well, dear viewers, healthcare can be complex, but it can also be very expensive, especially for the Americans. There are many factors that contribute to the high cost of healthcare in the country. Well, these include wasteful systems, rising drug costs, medical professional salaries, profit-driven healthcare centers, the type of medical practices, and health-related pricing. Well, if we talk about healthcare in the US, the majority of Americans rely on private health insurance for coverage. Statistics show that 91.4% of the population has coverage. Compare that to 99% to 100% of the population who have healthcare coverage in other industrialized countries. The US healthcare system is complicated, and most of the costs involved are market driven. High unregulated prescription drug costs and healthcare providers' salaries rank higher than in other Western nations, while hospital care accounts for 31% of the nation's healthcare costs. Administrative regulations regarding billing and coding also add to an individual's cost. Well, there are many factors that affect the cost of healthcare in the United States, but as salaries for American workers have risen, net pay remains the same due to the increasing cost of health insurance. So there are the 6 reasons. That's why we can say that the US health insurance or healthcare is more expensive than any Western country. Well, on number 1, it is multiple systems. The US healthcare system is highly complex. There are separate rules, funding, enrollment dates, and out-of-pocket costs associated with the various forms of health insurance, whether it's employer-based, private insurance, or government provides. Consumer must choose among several tiers of coverage from these options. They include high deductible plans, managed care plans, and fee-for-service systems. These plans may or may not include pharmaceutical drug insurance with its tiers of coverage, deductibles, co-pays, or co-insurance. Reason number 2 is rising drug costs. Americans shell out an average of almost twice as much for pharmaceutical drugs as people in other industrialized countries. High drug prices are the single biggest area of overspending in the US. Compare that to Europe, where drug prices are government regulated and often based on the clinical benefit of the medication. In the US, private insurers can negotiate drug prices with manufacturers, often through the services of pharmacy benefit managers. However, Medicare, which pays for a hefty percentage of the national drug costs, is not permitted to negotiate prices with manufacturers. Reason number 3 is higher salaries for medical professionals. The average annual salary for a family doctor in the United States was $235,930 in 2022. Emergency room physician commanded an average annual salary of $310,640. That's why above the average in other industrialized countries, including Belgium. In Belgium, it's $202,131. In Finland, it is $192,939, and in the Netherlands, it's $164,155. American nurses make considerably more than most developed nations. The average salary for a US nurse is about $77,600, second to Switzerland, where they make $87,383, but it's more than Australia, Israel, and Ireland, where nurses make $54,340 or $53,042 and $49,504 respectively. Well, reason number 4 is profit-driven hospitals. Hospitals' care accounts for 31% of the nation's healthcare costs. Expenditures in this category grew 4.4% in 2021 to a total of $1.3 trillion. This figure includes COVID-19 relief. Prices in the United States remain high for inpatient services compared to other countries, according to a report released by the HealthCare Cost Institute in July 2022. Reason number 5, defensive medical practices. Both physicians and hospitals have an interest in preventing lawsuits, so just in case tests and scans may be ordered, and these tests can be costly considered. The average cost of an MRI in the US was $580, second to New Zealand's, which is $819, but it was higher than $120 paid for by people in Spain. Reason number 6 is varying healthcare prices. Because of the complexity of the system and the lack of any set prices for medical services, providers are free to charge what the market will bear. The amount paid for the same healthcare service can vary significantly depending on the payer, such as private insurance or government programs, such as Medicare or Medicaid, and geographical areas can also have a big impact on the cost. For instance, services may cost more in metropolitan centers like New York compared to rural areas like Salt Lake City. Well, dear viewers, so basically because of the complex healthcare system of US, the doctors or the hospitals or the medical health insurers can get any amount which they like or they want, or they can see that you can tolerate or you can pay. So that's the main reason behind high cost or expensive insurance, health insurance in US. Well, dear viewers, thank you so much for watching me. That was all for today. I hope I have shared very deeply, or I have explained very well to you about the reasons behind expensive healthcare in the USA. So that was the 6 main reasons behind the very expensive healthcare or health insurance in USA. So that was all for today. I hope you like this video. If you do so, then please do subscribe for such more videos, and do share with your friends and family. I will see you in next video. Till then, take care. Bye bye.